If you've been dealing with chronic neck pain, shoulder tightness, and even headaches that won't go away, there's a good chance it's not actually coming from your neck or your shoulders. I know this sounds strange, but stick with me because I'm going to show you a 30-second test you can do right now to find out if this is your problem. Stay tuned for the end of this video and I will give you the 30-second test. I'm Dr. Michael Gartner, double board certified plastic surgeon and physician with over 23 years of clinical experience in practice. Now you might be wondering what a plastic surgeon knows about neck, shoulder pain. Here's the thing. I work on faces and necks every single day. And one of the most common issues I see in my patients has nothing to do with their skin or their fat or their muscle tone. It has to do with their jaw. Specifically, chronic tension in the muscles you use to clench and grind your teeth. Here's the problem. How many people have tried massage, physical therapy, chiropractic adjustments, even injections, and gotten nowhere? The pain comes back within days, sometimes hours. That's because you're treating the symptom, not the source. The source, in a huge percentage of cases, is right here in your jaw. Almost nobody is looking there. Let me explain how this works anatomically, because once you understand the connection, it'll make perfect, complete sense to you. You have a muscle called the masseter muscle. This runs along the side of your jaw here. It's one of the strongest muscles in your body relative to its size, and its job is to close your mouth and help you chew. You also have temporalis muscle, which fan out across the sides of your head, and pterygoid muscles deeper inside that help with grinding motions. When you're stressed, anxious, or concentrating intensely, most people unconsciously clench their jaw. Sleep, a huge percentage of the population grinds their teeth without even knowing it. This is called bruxism, and studies suggest that anywhere between 30 and 40% of adults do this. Here's the problem. When these muscles are constantly contracted, they don't just stay tight locally. They create a chain reaction. The masseter and temporalis muscles connect your skull and share facial connections with the muscles of your neck, particularly what's called the sternocleidomastoid muscle. Now, the sternocleidomastoid muscle and the upper trapezius. When your jaw is clenched, it pulls everything else into tension. Your neck tightens, your shoulders creep up towards your ears. The muscles around your scapula lock down. There's also a nerve component. The trigeminal nerve, which controls your jaw muscles, has connections that refer pain to your temples, your forehead, behind your eyes, down to your neck. This is why so many people with chronic jaw tension also get headaches that seem to come from nowhere. So when you go to a massage therapist, physical therapist, and they all want to work on your neck and your shoulders, and it feels better for a day, then the pain comes right back because no one's addressing the jaw. The source is still firing, still creating tension, still pulling everything tight. So what causes this? What's actually causing your jaw to clench in the first place? Well, the biggest driver is stress. When you're under chronic stress, your body holds tension, and for most people, the jaw is where it accumulates. You might not even notice you're doing it. You're sitting at your desk, focusing on a problem, and your teeth are pressed together. You're lying in bed trying to fall asleep, and your jaw is clenched. You wake up in the morning with your sore face, and you don't connect it to anything. A major cause is also your sleep. If you grind your teeth at night, which again affects roughly 1/3 of adults, you're putting an enormous pressure on these muscles for hours while you're unconscious. Some people grind with enough force to crack their teeth over time. Imagine what that's doing to your muscles and the surrounding structures. This constant pressure there. Bite misalignment can also contribute as well. If your teeth don't come together evenly, your jaw muscles have to work harder to compensate, and that creates chronic tension when you're not stressed. And there's a feedback loop with posture, especially forward head posture, looking at screens all day. When your head just juts forward, it changes the position of your jaw and puts additional strain on the muscles that have to hold everything in place. So what do we do to fix this? How do you actually fix this? First, you need awareness. Most people clench without realizing it. So you need to start catching yourself throughout the day. Set a reminder on your phone every hour. And when it goes off, check your jaw. Are your teeth touching? They shouldn't be. At rest, your lips should be together, but your teeth should be slightly apart and your tongue resting on the roof of your mouth. If you notice you're clenched, consciously relax and let your jaw hang loose. Second, manage the stress that's driving the clenching in the first place. Breathe work, meditation, regular exercise, whatever works for you to get the nervous system out of constant fight and fight mode. Third, address the nighttime grinding if that's an issue for you. A custom night guard from your dentist can protect your teeth and reduce the intensity of grinding. It doesn't stop the grinding entirely, but it limits the damage that can reduce muscle fatigue. Fourth, release the tension that's already built up in these muscles. You can massage your own masseters by pressing firmly along your jawline, making small circles. It might be surprisingly tender if you've been clenching for years. Stretching your jaw by letting it hang open, not forcing it, can also help. There's also a treatment I actually offer in my practice that works remarkably well for this. Botox injection into the masseter muscle. It relaxes the muscle, reduces the force of clenching and grinding, and within a few weeks, many patients notice their neck and shoulder pain significantly decreased because the source of the tension is finally turned down. As a bonus, it often slims the lower face if the masseters have been enlarged from all that clenching, because those muscles do get bigger over time and makes your face look squarer, which is why many people seek it out for cosmetic reasons. But the fundamental benefits are just as significant. Here's the test I promised you at the beginning, and it takes about 30 seconds. Take your fingers and firmly press along your masseter muscle. There's an area in front of your ears, along the angle of your jaw, the part that bulges when your teeth clench. So clench your teeth, feel the part that bulges, press in and feel around for tight spots or tender points. Now do the same thing on your temporalis muscle. Close your jaw, clench it tight, and feel where the tension is. Place your fingers on the temporalis while you press, while you clench and release. Do this a few times. Feel for tightness and pain. If either of these areas are noticeably tender or painful when you press on them, that's a strong sign that your jaw tension is contributing to your neck and shoulder problem. Now, here's the second part of the test. While you're pressing on those tender spots in your jaw, hold pressure for about 20 to 30 seconds and notice what happens in your neck and your shoulders. If they start to relax or the pain decreases even slightly, you've just confirmed the connection. The jaw is the driving problem. This tells you that all the neck massages in your shoulder, all your adjustments in the shoulder won't fix this until you address what's happening in your jaw. Most people suffering from chronic neck pain, shoulder tightness, and tension headaches have no idea that their jaw is involved. They keep treating symptoms and they never get lasting relief because nobody looks at the actual source. Now you know what to do and what to look forward and how to start fixing it. If you found this helpful, please like and subscribe. I'll see you in the next one. And here's to looking better and living longer.